Can you see the presentation right now?
Yes, clearly.
Okay. So actually, today's lecture will be about the R1 Mini and how its design changed the way it performs inside the canal, managing difficult anatomies. I've been working with Fanta a long time ago, starting 2016, 2017, maybe. So a generation of AF rotary grade files that I already used a long time ago. In literature, it shows already great performance compared to a file system like 𝗏𝗘 𝗏𝗀 in terms of torsion resistance and cyclic fatigue, and also bending resistance. And the 𝗏𝗘 𝗏𝗀 built on the base of 𝗏𝗘 with a variable taper file, 3 shaping files, 3 finishing files. The variable taper here shining because of how the design and the taper of the file allow coronal and mid-root preparation with shaping files. However, at the tip or the coronal part, apical part of the file, it will make a glide path or mechanical glide path. And when it comes to finishing files, we have regressive taper. So no contact coronally, but better debridement apically. The AF1, the innovative flat side or flat design file, great flexibility, cutting efficiency because of the double S cross section, more resistant to cyclic fatigue, and also central preparation to the canal because of the asymmetric cross section. Then lately, Fanta provide the endodontic world with the grid system rising. Already we have many webinars about rising before. And regarding reciprocation systems, Fanta already have the AF Flow R3, and lately we have the R1 Mini grid system with mega performance. So if you are talking about the R1 Mini, we need to know that the design and the cross section, the taper, the alloy of R1 Mini express many advantages that we have during the shaping of root canal system. It's a simple sequence, just 2 or 3 files, many invasive. It shows too much of flexibility, and also it is very safe when it comes to difficult canals. So the sequence of our system, the R1 Mini, is pre-flaring file 1905 of cutting blades of length just 13 millimeters, 1704 as a mechanical glide path file, and 2506 for shaping, final shaping. So in most of cases, that would be enough because it allows our irrigation to reach to the apex for better disinfection. Sometimes we can skip the first one, the pre-flaring file, and use only 2 files for shaping some kind of difficult cases like this one. As you can see, conservative shaping, preservation of pericervical dentine, and still it is efficient. But why our system is many invasive in shaping? However, the final shaping file is 2506. So I'm a big fan of pre-flaring. I believe that pre-flaring step is very important when it comes to avoiding the risk of file separation or perforation, ledges, all mishaps that could happen during shaping. Many of them we can avoid by pre-flaring. So the use of pre-flaring files is very important. And you know that in the past we used to use the gate signaling drills, but it's quite invasive. That's why now we're using the orifice openers or orifice shapers or pre-flaring files. But when it comes to pre-flaring files, we know that we need to maintain the pericervical region of our tooth as thick or as intact as possible, not to remove too much of the dentine at this part, because this is considered the neck of the tooth, as defined by Clark and Khademi. This part of the tooth is responsible for fracture resistance. When it comes to R1 our pre-flaring file is 19 𝗡𝗙5. We have 𝗡𝗙5 here, which is not common to have 𝗡𝗙5 or O5 taper for pre-flaring file. Usually we have like 𝗡𝗙9, 𝗡𝗙10, or 𝗡𝗙11, which remove much more dentin from that part of the tooth. However, with R1 our orifice opener or our pre-flaring file is 𝗡𝗙5 only, just to provide conservative preparation and makes the tooth more resistant to fracture. And when it comes to the 2506, this file has regressive taper with maximum fluid diameter of 1.1 millimeter. Because of the regressive taper, our file is cutting more at the apex, good apical debridement, and less contact to canal wall coronary. So it is not cutting coronary as much. So it also maintains much of the pericervical dentin. So it will allow our tooth to be more resistant to fracture because of preservation of pericervical dentin. This is how our R1 is conservative in shaping, thanks to the aggressive taper of our shaping files. For sure, the mechanical glide path file is already thin because it's a 17 𝗡𝗙4, so it's already thin. It will not cause any damage to tooth structure. And how it's flexible. When it comes to R1 and flexibility, we know that our system, the full system, is heat treated from mechanical glide path file 1704 and 2506. But we know also that heat treatment is not equal in the same system. So for our 1704 file is made of AFL alloy. AFL alloy has quite austenitic feature like stiffness and rigidity to be able to penetrate more inside the root canal system, especially in initial phase of shaping. And also because that file is quite slim, so need to make it more soft, like AFR or AFH, to give the file quite stiffness, not to be easily bent in initial phase of shaping. However, when it comes to the 2506, the files that would deal with the apical portion of the canal, with the tightness and narrowness in the canal, is made of or heat treated to AFR temperature. This part now it's highly martensitic. This file is highly martensitic. Highly martensitic means it is very flexible. The reflexor, especially that it has taper 6, so we need to make it flexible, not to change the geometry of the root canal, and it should respect the root canal anatomy. So here in the R1 we have what we call it the hybrid heat treatment. All files in the same system, not treated the same way, because we want to have like advantage of each temperature at specific phase of canal shaping. Our system also has a double S cross section, which is known for cutting efficiency, more room for debris removal. And as long as we have more room for debris removal, we have more cutting efficiency and also less possibility of getting locked inside the canal. Here you can see how much of debris between flutes, we call that part chip space. It's the distance between two flutes, we call that part pitch. So here you can see how debris and dentin mud coming in between the flutes because of the cutting efficiency and also the design, the double S cross section of the file. So now in our system, we have conservative preparation because it's minimally invasive, maintaining the pericervical dentin or more dentin at the pericervical region for the tooth to be more resistant to fracture. And it's flexible thanks to the hybrid heat treatment, and cutting efficiency is still high, so it's efficient. And when it comes to kinematics, the motion of the file, our file is a reciprocating file. So it's rotating in counterclockwise, cutting in counterclockwise, and we have a release angle in clockwise direction. For sure, this motion is safe because we don't have the continuous engagement of the file system inside the canal. or our file inside the canal. However, still we can use the R1 Mini in rotary motion. Just adjust our endomotor, go to into setting, and make it rotate counterclockwise because our blade is cutting in counterclockwise direction. So simply adjust the setting in endomotor in counterclockwise direction, it would become a rotary motion. So at that time, we can get advantage of safe when needed. If I manage difficult canal or severely curved canal, I can use reciprocating motion because it's more safe. We don't have the continuous engagement. And if it is easy, straightforward case, I can use the rotary motion or R1 in rotary motion. It will become efficient. And for sure, we can get advantage of both motion in the same case or in the same canal using the OTR. All Fanta motors, like the 𝗓𝗏𝗧 Pro and the 𝗓𝗏𝗧 Ultra, have the OTR function. That means the file would work in rotary motion counterclockwise, and when resistance or the torque become high on the file, the motion of the file or the motion on motor would shift to reciprocation, which is more safe. And once the torque released, the motion would become rotation again in counterclockwise. I'm showing you how I'm adjusting or how I'm setting my endomotor. Here, I'm using a rotary 500 RPM, 2 Newton per centimeter in reverse because our file is cutting in reverse. It's a reciprocating system. So this way, I can change to OTR function. This is the 𝗓𝗏𝗧 Pro by Fanta Dental. Now OTR, and make sure that the counterclockwise angle is higher than the clockwise. In this motion, our file would work in rotation. So for me, as a rotation guy or a rotation fan, I start by rotation with R1 Mini, and it's very efficient. And when it comes to difficulty inside the canal, the motion of our motor would shift to reciprocation for more safety. Here I'm showing you the sequence of the R1 Mini, starting by the pre-flaring file, 1905, very conservative, no much cut to dentin at this region or that part of the canal. Then we need to irrigate. After pre-flaring, we have better penetration of the needle inside the root canal system. Then we need to do manual glide path using file 10 in watch winding motion. This is a very difficult model to test a file of short sequence, 2 files only. No need to be in hurry during the manual glide path phase. Yeah, we can do it on just 2 or 3 phases to reach to working length. Don't push our file to reach to the apex. We need to go slowly. That's for safety. And once our file reach to the apical foramen or to the estimated length, we can use the mechanical glide path file 1704. As you can see here, I'm using it in rotary motion. And chronally, if you look at the stopper, once the torque increased on the file, the motion shifted to reciprocation for safety. As you can see, look at the stopper, direction mark. Now it's reciprocating. However, the motion already in the motor is rotary, thanks to the OTR function on 𝗓𝗏𝗧 Pro and 𝗓𝗏𝗧 Ultra. Better penetration now of needle inside the canal. Here's the 2506, the file for final shaping. For sure, we're not taking the file in one shot to the full length. We can use it only for mid-root shaping. Then we irrigate, recapitulate, then go again till we reach safely to the apex. Irrigation, as you can see, we have very good delivery of irrigant toward the apex. As you can see, the difficulty of the model, very difficult. And here, you can see that the motion shifted to reciprocating motion. Once we reach the apex, just 2-3 stroke and it's enough. No need to enlarge more. And here's the master cone fit. Very nice maintaining of the apical foramen size and site. Here on the radiograph, you can see how we're able to maintain the canal curvature. It is very difficult in these cases, but because of the hybrid heat treatment and flexibility of the file, the regressive taper, as you can see here, that we have minimal preparation at the pericervical dentin. So that's ideal preparation for a case like this. Let's go to some clinical cases and discuss and see how R1 Mini was able to manage and deal with difficult anatomy in safe and proper way. Here's a case. It's a lower second molar with deep distal caries reaching to the pulp. Patient has chronic periapical periodontitis. So we decided to do a root canal treatment in that tooth after opening access and pre-endodontic buildup. Need to irrigate. For sure, no file to enter the canal without irrigation. Starting by 1905, orifice opener was a little bit of brushing motion on the outer wall, the wall which is away from the bifurcation. Here's 2506. I'm using as long as can goes, so we can use it. Again, it's an OTR motion also, so getting the advantage of cutting efficiency and of rotary motion and safety of reciprocation. The Actor Eye Pro for activating the irrigant. The ultrasonic activation is very important. For sure, we need to limit the use of ultrasonic activation to the straighter portion of the canal, not to take it too much deep or below the curvature, so it would cause ledges or maybe perforations. It's better to use sonic activation for severely curvy canals or narrow canals. Here we have a middle mesial canal. Then we can start obturation using bioceramics, confluent mesial canal system. Then passive injection again into the distal canals. Also, they are confluent. And here's the case after obturation. Very, very beautiful shapes, very good maintaining of the root canal curvatures. It's very important to pay attention to these small details. Actually, most of file system was shallow or like light curve like this one. With shaping, step per 6 files tend to be straight and will not be able to notice it because already the curvature of the canal was like low curved or not too much of curvature. So using taper 6 and getting that beautiful shapes or beautiful maintenance to the root canal anatomy, the thing we should appreciate about the R1 Mini in shaping. Another case, which I will discuss with you in details, because it was very difficult. Here we have upper first molar with necrotic pulp and periapical lesion related to the distal root. If you look to the radiograph, here, okay, I can see the shadow of the distal canal, so it should be like easy one. However, when it comes to mesial, it's very difficult. It's like complete absence of the canal shadow in the mesial system. So we need to take care, we need to pay attention when we manage this canal, especially during shaping. So let's see together, starting from the axis, how we manage the access or the coronal structure, how we were able to remove bulb stones, how we manage the coronal calcification, how we managed to locate the MB2, that was very difficult, then how we shape the canals. So starting by round bare, just to get drop throw into the bulb chamber. Then the tapered with round and bare. I love to use the tapered with round and bare. For sure, in hand of experts, it's safe. It will not cause injury to the floor. However, I know it could be safe for most of beginners to use bare like the Endo-Z bare with safe end. But I believe most of endodontists use a tapered with round and bare for efficiency. So now continue making the outline of our axis. Then under magnification, I'm checking the pulp chamber. And here I'm doing refining to the axis. I have also stones, bulb stones inside. So using ultrasonics under magnification would improve the accessibility to the root canal system and the root canal orifices. With ultrasonics, better to start in dry field like this one, so I can see exactly where I'm doing my cutting. So I have the precision and the control. And after the pre-accumulated in the pulp chamber, we can open coolant to flush away debris. So we would have more cleaner or more clearer vision. As you can see here was a bulb stone. Then with the coolant, flush away. Here you can see also we have bulb stone. This one was on top of the orifice of the palatal canal. That's why also we need to take care not to be in rush with our files to go into the orifices or try to check if the orifice is patent or not. Again, with ultrasonic, high control, high precision, and here is the pulp stone on the palatal canal. Now I'm trying to locate the MB2. One very important trick you need to take care that can help you to locate MB2, you need to make the outline of your access cavity from inside, for the mesial side, parallel to the outer wall of the tooth, or we call it the mesial marginal ridge. And if you have absence of this wall because of decay, you can also make this line or the outline from here parallel to the gingival margin. That would allow better accessibility and better location to the MB2. And I'm showing you that now. So with ultrasonics, I'm removing the dentine shelf, trying to check the possibility of having MB2 or not. Starting by pre-flaring, 1905. Sometimes I keep hypochlorite inside the bulb chamber and give some time to hypochlorite to dissolve tissue. It would be easier to locate MB2. Pre-flaring in palatal canal. Irrigation. This is hypochlorite, full concentration hypochlorite. Pre-flaring to the mesiobuccal canal. Pay attention to direction of rotation. Direction of rotation is counterclockwise. So now I'm working in rotary. Rotary motion only, counterclockwise for only these two files, the mechanical glide path and for the finishing file. This one is already rotary in clockwise direction. So this one is rotary file, and both the mechanical glide path file of 1704 and the finishing file of 2506, we use it in rotary if you want, but you need to adjust the direction of rotation to be counterclockwise. Now I'm trying to locate the MB2 small file. Still, it was difficult. So here I'm following the rule of color change. In the floor of the bulb chamber, we have dark areas that I need to follow gently do some reduction using ultrasonic, magnification would help a lot. I'm encouraging every one of you to use magnification for cases like this, or to manage tiny canals or hidden or missed anatomy. Even eye loops would work, but to manage anything inside the canal, you need to use microscope. Again, with ultrasonic, but deepening or working deep onto the floor, because sometimes the orifice of MB2 is not at the same level of MB1, and here was the orifice of MB2. Yes, we got the catch. Now I'm doing the manual glide path. Don't be in hurry. Don't be in hurry. If your file stops after 1 to 2 millimeters, correction would be difficult. So irrigation very well, but your file, gentle watch winding motion, gentle watch wind and pull, watch wind and pull, clean your file flutes, re-irrigate, and go back again with your file. So now I'm sure that the coronal portion of the MB2 is patent, and this would be the first file to negotiate the coronal portion of MB2. This is the 1704 working in counterclockwise rotation to negotiate. Try to avoid the orifice opener or pre-flaring file in MB2 as a start. The first rotary file that should go in MB2 should be the mechanical glide path file. We know that MB2 always have special consideration to manage. Now I can do better irrigation, better delivery to irrigant inside the canal system. Now it's clear, and here you can see the floor map. A dark line on the floor connecting between the floor map and the MB2. (1704) to full length in this tubacal canal is for mechanical glide path. I'm working in rotary motion, more efficient. And on OTR, it would shift to reciprocation if needed. As what would happen in the mesiobuccal canal? As we see in the radiograph here, it's tight, narrow, we can't see it, so it is difficult. So our file is working in rotation because it's efficient, and when we have torque or load on the file, now it's working in reciprocation. So still, the R1 Mini working too good in reciprocation. We're getting advantage of the design and the taper. Now I'm enlarging 2506 for apical finishing. As you can see, now it's working in OTR, shifting the motion to reciprocation for safety. Once we reach to the apex, just 2-3 strokes and it's done. And here we can appreciate the presence of debris between flutes. Yeah, as long as we have big chip space, we can maintain the cutting efficiency of the file during the canal, decrease the lock and the torsional stresses. And here are the canals after preparation. Again, ultrasonic activation, the Actor Eye Pro. Great device for ultrasonic activation. You can feel the power, and you can see the cavitation effect under magnification. It's clear now that you can see the turbidity of irrigant thanks to cavitation in the aquatic streaming, losing the debris, detachment of smear layer from the wall for better cleaning. Now we need to inject our bioceramic sealer. You need to make sure that already bioceramic sealer at the tip of your needle here, so you avoid over extrusion or pushing the sealer below the foramen or beyond the apical constriction. This tubacal, mesiobuccal, MB2, and here is the palatal canal. You need to ensure also that the tip is free inside the canal, not to push too much amount of sealer. And here's the case after obturation. MB1, MB2, and the palatal canal. And here's the poster radiograph. Again, pay attention to the anatomy, pay attention to curvatures. However, it is like not severely curved, but still maintained. Thanks to the regressive taper, thanks to the flexibility because of hybrid heat treatment and the R1 mini, curve like this, another one like this, so it's a multilinear curvature. Another one here at the apex, still maintained very well. So the respect of the anatomy could be seen very well after shaping with the rising system. And again, when it comes to minimally invasive, here's that part of the tooth, which is a pericervical dentine, that we need to maintain as much as we can. And after obturation, you can see here that we have enough amount of dentine thanks to the conservative preparation and also the conservative shaping by R1 mini. Just remember that the maximum fluid diameter of the R1 mini, even the file is 2506, the maximum fluid diameter is 1.1 millimeter. The orifice opener is 1905. This is not common between orifice opener and between different systems from different companies. We used to have orifice opener of taper 8, 9, 10, 11, sometimes more, but here our orifice opener is 1905 for minimally invasive preparation. And if you want actually to enlarge the coronal portion or the coronal third of the canal, if the case is very difficult or has multilinear curvature, you can use the orifice opener like many times on the outer wall, give it more time on the outer wall. With brushing motion, it will enlarge the canal more than its size. So you can enlarge also when needed, but in general, it's a minimally invasive system thanks to the regressive taper. Last case, again, case of retreatment and lubricating files, efficient also in retreatment and get the removed. We're going deep into the canals. We need to use ultrasonics for controlled removal of old restoration, removing the tubercle from the canal orifices. Yeah, dry, then open colon to flush away debris. Again, with ultrasonics, let's jump to the files part. And here you can see that 2506, I started by 2506 because it's a case of retreatment. I'm using in rotary motion, counterclockwise direction. Already we discussed in many webinars before the motion of the files and how you can, as you can see here now, it's working in reciprocating because of the OTR function on iRoot Pro. So in your endomotor, you have safety feature that would allow you to avoid many kind of errors that could happen during checking. Very efficient in tubercle removal. Usually after removing the tubercle from the root canal system, irrigate and activate the irrigant, your shaping is done. Ultrasonic for removal of intracanal filling material and intracanal tubercle. Now working in distal canal directly with 2506 and OTR. Pay attention to direction of the fluids. It reciprocates when needed. Very nice file, we need to give it a try. Simple sequence, So no much time for shaping, giving more time to irrigation and chemical disinfection. Now, apical glide path for that parts using 1704. So I use 2506 for pre-flaring. Yeah, I can use it for sure. Then mechanical glide path. Then I can go back to 2506 for apical finishing. So it's like double action file. Can use it for pre-flaring, just to the coronal portion. Mechanical glide path using 1704, then go back to 2506 for apical finishing. Again, actor eyebrow is dominant in all my cases. Cavitation, aquatic streaming, and intracanal heating. One minute in each canal. Alternate with hypochlorite and EDTA. The obturation was bioceramic. In wide canals like this, don't rely on single cone with bioceramic. You need to put the master cone or the master cone that you select, plus passive auxiliaries without the weight of spreader, just to be able to push sealer in tiny and fine spaces. And here's the case after obturation. Again, well-maintained anatomy of the root. So from what we discussed regarding the design, the taper, the hybrid heat treatment, the cross-section of the file, and the cutting efficiency, all these advantages make R1 Mini file of selection in difficult cases, because also of its short sequence. Imagine preparing canal with 2 files only, so less risk of file separation or less risk of mishaps, rather than using 4 to 5 files to reach to 2506. So in case like this, for sure 2 files could be enough to manage and shape, and difficult cases, maybe you need to use the OTR for safety. So that was my today's presentation. I hope it was clear, and soon we have more webinars about Rising R1 Mini, 2 great systems that raised lately that become my favorites. So thank you and see you soon. Bye-bye.